Greetings, everyone. We are the members of Group 404 from the DNA program, and today, we're excited to present our innovative Smart Hospital project, which has been a significant focus of our efforts. The healthcare facilities in Malaysia involve a network of collaboration between departments for medical needs and administration. The moment a person visits a hospital for consultation or seeking treatment begins at the reception area, where the person needs to register their purpose for the visit. This requires entering patients' details into the Person Information System, PMS, retrieving past records, and directing patients to the appropriate medical service. However, in the traditional healthcare setting, the reception requires all input to be manually performed, causing frustration for waiting patients, poor quality of customer care, and inefficiencies for both patients and the medical department. There are several more challenges hindering the patient from having a quality experience, especially for the disabled community, who may face more challenges than others, including accessibility to services. Let's delve deeper into each of these issues and explore how iHospital can revolutionize healthcare to overcome them. First issue we have is long waits. Patients often find themselves waiting for extended periods because the process of registration takes time, and this leads to a crowded waiting room. These long queues not only lead to frustration but also contribute to inefficiency in resource utilization. Patients might have to allocate substantial time solely to wait, causing inconvenience, including requiring the people to apply for unpaid leave when accompanying families to hospital visits, which ultimately disrupts their daily routine. Second issue would be shortage of manpower. Traditional healthcare systems require a significant amount of manpower to manage administrative tasks, registration, and patient flow. Many parts of the global world have a high shortage of manpower in the hospital industry, including Malaysia, as reported in the Labor Statistic 2023. Hence, the overall experience of a patient is often exhaustive, having to wait for assistance, especially in government hospitals. Lastly, lack of accessibility for disabled individuals. Many public and private healthcare facilities are not adequately equipped to accommodate individuals with disabilities. Though there are wheelchairs accessible for the physically challenged, there is no assistance to support those who are deaf and verbally impaired. The deaf community are dependent on a family member or a friend for support. Resources providing special assistance such as sign language assistance, also known as American Sign Language, ASL, or Bahasa Isyarat Malaysia, BIM, is not available, making it challenging for them to access medical services independently. The lack of inclusivity not only restricts healthcare access, but also sends a message of exclusion and neglect for the community of disability. Through identifying the main issues and problems that are happening in the traditional healthcare setting of Malaysia, we recognize these issues and challenges mainly cause inconvenience for patients and visitors seeking consultation and treatment at the hospital. Since we are in the era of digital innovation, we are proposing to digitalize the traditional healthcare setting into proactive measures that can create a smart and innovative healthcare environment that prioritizes efficiency, inclusivity, and patient satisfaction. Thus, we're excited to introduce our innovative hospital that comes with a new device, kiosk, and robot, as well as an application, iHospital application. The iHospital app is a groundbreaking, powerful tool designed to revolutionize the way hospitals operate and interact with patients. It is committed to providing a more innovative, more efficient, and patient-centric healthcare experience. The iHospital app is set to transform traditional hospitals into cutting-edge smart healthcare hubs. Let's explore this in greater detail. The iHospital project introduces two key devices to enhance the healthcare experience. The first device we have is the kiosk. This device empowers users to streamline their registration process independently by inputting essential personal details like name, age, and identity card number. Additionally, it features a calling robot service, complete with a user-friendly interface and a dedicated function call button, known as the iRobot, enabling users to request robot assistance as needed. Furthermore, the kiosk facilitates self-check-in using the iHospital application on mobile devices, offering patients a convenient way to expedite their check-in process. The second device in this initiative is the robot. It acts as human guidance for guiding the user or the patients to a place they want, and assisting individuals with disabilities to communicate with doctors or nurses with translation by sign language. The network infrastructure for the iHospital project comprises a local area network, LAN, 5G, and Wi-Fi connectivity. The LAN interconnects all kiosks, facilitating high-speed data transfer and enabling the utilization of shared resources, including internet connectivity and servers. The 5G network is harnessed to connect the robots, ensuring both high-speed and low-latency communication, which enables these robotic assistants to provide immediate responses to user queries and requests. Additionally, Wi-Fi connectivity plays a pivotal role in connecting mobile devices, facilitating the seamless use of the iHospital application, thereby enhancing the overall accessibility and convenience of healthcare services for patients and users within the hospital environment. The iHospital application provides users with the capability to schedule appointments by selecting from available time slots, while also offering the convenience of canceling or rescheduling appointments as required. The first key expected benefit is that users will not need to wait in long queues for registration, thereby improving their satisfaction with the Department of Reception or Registration. When a user wants to make an appointment using the iHospital application, they can book an appointment with available time slots, which helps with better time management. Additionally, users have the option to cancel or reschedule appointments through the iHospital application. The second key expected benefit is the solution to manpower intensity. With the introduction of the kiosk, users or patients have two options for registration: manual registration at the reception counter or self-registration at the kiosk by simply filling in their details. The third key expected benefit is improved accessibility for individuals with disabilities. The user interface of the kiosk is designed with a special function call button, known as iRobot. Whenever patients need assistance, this special function call button provides them with immediate help. The robot acts as a human guide, leading them to a room or any other location. In addition, individuals with disabilities such as visual impairment or hearing impairment can receive assistance from the robot in the form of sign language translation, enabling better communication with doctors or nurses. In conclusion, by this model of digitalization, we are ushering hospitals into a new era of innovation, centered around the needs of patients. Through the seamless integration of cutting-edge technologies, healthcare will undergo a remarkable transformation. No longer will hospitals be synonymous with long waiting times, overcrowding, and environments that are not conducive to those with disabilities. Instead, healthcare is becoming increasingly efficient, remarkably convenient, and accessible to everyone. Thank you for listening attentively during the presentation. If you have any questions, please kindly submit them in the comments section. We wish you a wonderful day.